today's video I'm going to show you how to give a very gentle hand massage. To carry out a gentle hand massage, what kind of equipment do we need? We need to use either massage wax or oil, for example almond oil. If we use wax, we should have a little paper pot to put them in, as well as a wooden tongue depressor for taking the wax out of the tub. We should have clean towels and maybe a pillow or cushion to rest our hands on it. It's a good idea to carry baby wipes in case the person has dirty or sweaty hands. Sterile gloves are optional in case the patient has a skin rash, and by that same token we should carry some plasters with us in case we get any cuts ourselves. And some gentle background music can create a nice atmosphere, although it isn't really necessary. First of all, positioning. Make sure that you are positioned comfortably close to the person that you are going to massage, but also not too close that you are invading their space or making them feel uncomfortable. You can also have a very small little table to the side which you put a towel over. It's important that you can get close, and it's also comfortable for the person that you're going to massage. You don't want them extending their arms in an uncomfortable way, because then the treatment will have the opposite effect to what is intended. I use a brand of wax called Songbird. They come in various different types of mixtures. It's already mixed waxes. They have waxes for reflexology as well as body massage. Some people prefer to use oils, which were more traditional. I personally prefer to use waxes. I find them a lot more easier to use and less messy, and there's less leaks in your bag when you're carrying them. Now with the waxes, you apply them to your own hand rather than apply them direct to the person's hand that you're going to massage. Be aware of sterile and hygienic practices. I use little medicine pots which I put the wax into using a tongue depressor, and this avoids me dipping my fingers into the pot, which of course can bring in bacteria or other bits of dirt. Apply the wax to your hand and rub it in, and you don't want to use too much wax. You don't want your hands to shine brightly and blind your patient if the light reflects off it. That means you're using too much wax. You don't want too little either. So get the right amount and rub it in. If you use too much, you can just use the towel and just wipe off some excess. Before you launch into the treatment, a couple of considerations. Firstly, make sure that you've got permission to massage a person's hand. This may seem a very strange thing to say, but we do need to make sure that we have the person's consent, and by consent we also need to have informed consent. You need to explain to them what it is you're going to do and make sure they agree. Now, some people are not in a position to agree. If you were to give a massage to a person in a hospital bed in a coma, for example, and these are extreme examples, if a person was asleep and you started massaging their hands, again, you don't have consent. And I think it's important from a legal point of view to make sure you've got some sort of consent. Explain to them you're going to do a massage, you're going to use some wax. Before you start to massage, have a look at their hands. Do you see any cuts, any bruises? Ask them about their general health, if they have any medical conditions or are taking any medications, as well as ask about the general condition of their arms and hands. For example, any surgeries, any past accidents or injuries that you should be aware of, or arthritis. If there is arthritis, it does not mean that you cannot treat it, but you do have to be very, very gentle around those areas, almost light touch, and even avoid certain areas where there's inflammation or knottiness. You may also adopt simple touching or just gentle holding. It's important to be adaptive to the patient. If they have lots of cuts or even ulcers, you may indeed avoid treating the hand or use gloves. Make sure they're okay, they don't have any sensitivities to the wax you're using. Now, before launching into treatment, connect. You need to connect with the person first. And the best way to do this is simply to lay your hands on the hand. And this is a way of saying hello. You are tuning into the person in front of you, and you're allowing them to tune into you also. Inside, you will be relaxed and calm within yourself, and that calmness will influence the person that you are going to treat. They will pick up on that, and if they are feeling in an anxious or distressed state, your calmness will help them relax more. Now you can wrap a towel around the hand that you're not going to be massaging to keep it warm. In this example, I'm not going to do it, so that you have a better view of the hand that I am going to massage. Lay your hands on and make a connection. You can ask the person to take a few breaths, normal, relaxed breaths. And yourself, you take a few breaths too. And we're going to start with some simple effleurage strokes, very gentle strokes. And the pressure is very light, not too heavy. And you're stroking from the body and outwards. And turn the hand over. Do the same thing to the palms. And it is in the palms where a lot of tension is held. And when you do press on these points and open up these areas, the person having the massage will feel very relaxed. So from the body, and flow your hands outwards. Now the next move is a fanning motion. You use your fingers as a kind of gentle lever, and your thumbs fan outwards like a butterfly's wings. You use your fingers to gently support your hands, and your thumbs gently, and I emphasize the word gently, fan outwards from the midline outwards, and go along the hand from the wrist to the top of the hand, and again gentle, not too much pressure. Turn the hand over and do the same thing, your fingers supporting underneath, and this time you're opening up the palms. From the midline and outwards. There's a lot of tension held in the palms, in the muscles of the hand. This will help release it. And just return back to a effleurage, a nice gentle stroking outwards again. In the center of the palm are 3 pressure points that are good to massage. One is the Heart 8 acupressure point, which is between the 4th and 5th metatarsal bones. There is also another acupressure point called Pericardium 8, which is between the 2nd and 3rd metatarsal bones. And right in the middle of the palm is what is sometimes called the palm chakra point. It doesn't really matter whereabouts you massage which of these points, they all relate to the heart energy and have an influence over the emotions. So find a point in the middle where you feel a dip and give it a circular motion. Again, very gentle, don't go too deep, don't go too strong, just a gentle sinking into the point. This is not a pushing, but it's a sinking. You rest your thumb on the point and gradually allow it to sink into the point and do some circular motions. This is another acupuncture, an acupressure point. This point is called large intestine 4 or Hegu in Chinese. It is on the dorsum of the hand. It's at the high point of this muscle, which is in between the thumb and the index finger. When you bring your thumb and finger together, find the point and again sink into it. This is a contraindicated point for pregnant women. If you're pregnant or suspected of being pregnant, you are not supposed to use this point because it is supposed to make the energy of the body descend. so it is not used for pregnant women. This point is known as a pain relieving point, particularly for the upper body or the upper head. It's used in Chinese medicine for toothache, for headaches, for migraine, for neck pain. Simply find the point and gradually sink into it. You can do some circular motions, or you can just simply sink and just leave it there. And that pressure itself is stimulating along this energy channel pathway. The energy channel pathway goes up the arm into the head and neck area. Here I'm doing a small circular motion. Turn the hand over and don't neglect the wrists. Firstly, I'm going to show you another acupuncture point or acupressure point. It's on the inner side of the wrist. It's between the two tendons in the middle of the wrist, about 2 finger breaths into the body. 2 finger breaths, and then the point is where the third finger will be. Feel around for a kind of area between the 2 tendons and give it a very, very gentle rub. This is pericardium 6 acupuncture or acupressure point. It is used for nausea and vomiting. It is also good for calming the emotions because it relates to the heart channel. It has been used in hospices and hospitals in research studies to see if it can help with nausea and vomiting, particularly related to chemotherapy. Give this a nice gentle rub. It's also used for morning sickness. And again, just returning back to stroking the hands. Now I'm emphasizing here not to use strong pressure. Everything about this is gentle. If you have a tendency to think that more is better or no pain, no gain, this does not apply to hand massage. It's completely the opposite. Less is more. So we'll go back to stroking. Don't forget to stroke around the wrist area. Again, we have a lot of tension in our forearms and wrists, the outside and the inside. As you get more sensitive, you will find that you can feel the tension and you can help relieve the tension. You can do a slight squeezing action, very gentle. Just slightly squeeze, release, squeeze, release. We're going to work on the fingers and the thumbs. So squeeze the muscle, release. Squeeze the muscle of the fingers, release. Squeeze and release. Avoid the joint areas. You want to squeeze in between the joints where the fleshy parts of the muscles are. So squeeze and release. A gentle squeeze. Squeeze and release. Squeeze, release. Squeeze, release. Squeeze, release. Squeeze, release. From the body and outwards. This is the direction you're going. You're pulling the stagnant energy out of the body, out of the channels. Squeeze, release. And then you also want to press the nails, the nail beds, because there's a lot of tension around the nails. There are acupuncture points in the corners of the nails. So just give a little squeeze and release with one finger underneath the thumb and the thumb on top of the nail. So squeeze and release, squeeze, release. And again, it's a very gentle squeeze and release. Test on yourself just how hard you can go. And again, returning back to the effleurage, the gentle flowing movements. And now we come to an end. And again, just as you said hello, say goodbye the same way. Place your hands, connect. So now we'll go to the next hand. And again, here we take the wax out of the medicine pot. Rub it onto your own hands first. And apply it to the person. So just rub it in. connect. Take a few moments. Just center yourself. Take a few breaths yourself. And then slowly rub some of the wax into the person's hand. So here you're doing two things. You're releasing some of the tension and you're also rubbing the wax in. And you're flowing from the body and outwards. This is the direction of the energy flow. And the gentle strokes, you're getting ready, you're warming up the hand. And we're going to start here with the butterfly wings, the fanning motion from the midline and out. Using your thumbs, pressing from the midline and out in a fanning motion. Turn over, and again the same thing with the palm of the hand, the butterfly motion from the midline and out. As you do this, you may be aware of tension in the hands, in the muscles of the hand. And of course, whilst you're doing this, you can talk if they want to talk. If they want to relax, you can leave them to that as well. And here I am stimulating the heart point in the center of the hand. It's a key acupuncture point. It's one of the opening points of energy into the body and out of the body. Here I'm giving it a little bit of a push. But again, it's a gentle push. I'm connecting to the point. It's good for emotional, for anxiety and sleeplessness as well. The heart is related to sleep and the blood. And then we go to the large intestine 4 acupuncture point. Again, a gentle massage, circular motion. You don't want to press too hard. Remember, this is a treatment to relax, not to stimulate. Then the pericardium 6 acupressure point on the wrist, and just pressing that. Circular motions. It doesn't need to be this long. It can be a very short period of time, just 10 seconds is fine. So squeeze and release, squeeze and release. Some gentle effleurage, you can throw this in at any point. Don't forget the wrists. And massage the fingers again, the muscly parts between the joints. Squeeze, release, in a gentle way. Then there's the nail beds again, a gentle squeeze and release. Gentle squeeze and release. Squeeze and release. And to end, place your hands on their hand and take a few moments to ground yourself and to relax and to say thank you. It's a simple finger hand massage, and yet a very powerful way of connecting and also helping someone to relax. It's a technique, it's a therapy that anyone can use. And at the end, you need to rub some of the wax off their hands, and this itself is part of the treatment. Wrap the hand in the towel and just slowly massage the wax off their hand. This itself becomes a relaxing way of bringing the treatment to an end. The good thing about this type of wax is that it gets absorbed into the hand, and it's actually very good for the skin. And remove the wax from the other hand as well. I'd like to say thank you for my wonderful hand model, Flo, of spacetoflow.com and Dragonflow Yoga, for allowing me to make this video. Namaste.